From NBC News, we have doctors say they're finding it increasingly difficult to distinguish Rona from allergies or the common cold even as hospitalizations tick up. Isn't that just fascinating? It appears that the people who are being called conspiracy theorists consistently throughout the entirety of the COVID pandemic, and certainly at the beginning when they were talking about how this novel respiratory illness needed to be handled like any other respiratory illness, and what did they do? They said we needed to lock down the world, restructure how we all fundamentally operate in society, we had to blow out the global economy, remove kids from school, destroy their education, pull people out of work, tell them they were non-essential, force mandates for masks, force mandates for vaccines, and in the end, what happened? It turns out that we're going back to the narrative that the people who were banned on social media and removed from the public square, unable to talk, told they were invaluable, and that what they had to say had no value, didn't matter if the fact that they were experts in these certain fields that were simply saying things that didn't toe the establishment narrative. No, that didn't matter. What we needed to do was stop everyone from saying anything that didn't go along with what the establishment was pushing when it came to the COVID. Oh my god. If I end up losing my shit during this video, don't be surprised. Let's go ahead and move on. What we see is Empire State Building, blue and cyan tonight in partnership with the iHeartRadio Tower in honor of a new vaccine. No, this is not a joke. This cringe is real. We changed the color of the Empire State Building because we care so much about the new vaccine to fight off the new COVID variant. At what point could anyone that has a thinking brain see this and not just think, yeah, that's propaganda from Big Pharma? Really, be honest with yourself. And if you're not a thinking person, well, you see this and you're like, well, yeah, they really care about public health. If they really cared about public health, maybe they would actually pay attention to stuff like the obesity epidemic or the fact that people are so metabolically unhealthy that only 12% of Americans are only metabolically healthy. I will go ahead and link a video above right here if you would like to go watch my video recently. We need to bring back fat shaming and we need to make fat shaming great again. Let's go ahead and continue on with this video, because if they really cared about people's health when the fact of the COVID crisis was happening, they would have talked about the fact that people need proper nutrients. They need to eat proper diets. They need to have exercise. They need to have proper, wait for it, nutrition. Nothing more than having your vitamins, vitamin D, vitamin C, getting your sunlight, walking 5,000 to 7,000 steps a day. But what did they do? They closed people inside. They made people shut away from everyone else so they couldn't interact with other individuals, so their immune systems got completely nerfed. No capacity to buff themselves to the viruses that were growing around the world, which is why when things actually opened up, you saw this mass wave of illness, and that mass wave of illness was because so many people had been removed from the global population for so long with no capacity to interact with so many different people, which means their immune systems had no capacity to interact with the viruses that would naturally be correlating throughout society. Okay, let's go ahead and jump into this. It says the internet does not forget, and no the fuck it does not. Right here, the media demonizes the unvaccinated and champions mandates. 2023, the media are reporting vaccine injuries in the COVID vaccines. And this is from the same exact person. Do not let anyone in the establishment off the hook when it comes to the nature of what they were pushing with the COVID vaccines, with the COVID mandates, consistently pushing people to subtly encourage them to go ahead and get this shot. I mean, I know President Biden couldn't actually get you to mandate it by the process of telling you what to do through the federal government and then pushing it through the state. But what he could do was push it through OSHA, and then that ended up leading to so many people having the threat of their job being removed and taken from them, and considering the fact that 40% of the value of their labor has already been stolen from them with the mass inflation that has hit the United States currency over the past 20 years, well, it appears that these people a lot of times really didn't have the option because they have families to take care of, and their wealth is being strip mined from them by the global elite, and with that comes the fact that they had to go ahead and take this forced mandate, even though apparently it's not going to be talked about as if it was forced. But that doesn't really matter, because what matters is people were coerced into taking a medical procedure that they otherwise would not have taken. And that is criminal. And we need Nuremberg 2.0 trials at the minimum. Let's go ahead and jump into this video.
Mandating vaccines like this, like they're doing in France, to enable them to open up is a very sensible approach. I've heard many commentators on this channel over the past week strongly objecting to restaurants and retail outlets mandating vaccines for customers. If you're a customer going into a store, you want to know that the people working there are vaccinated. If you're in a restaurant, you want to know that the people sitting alongside you, breathing in the same air as you, have also been vaccinated.
The people breathing in the same air as you, they must be vaccinated, otherwise they're impure. This is literally the mentality that was being pushed by so many people. And it's not because so many people were just bad individuals. That's bullshit, and don't ever let anyone convince you of that. What happened was, this is when people have been propagandized into such a state of fear that they're willing to accept so many things that they otherwise would never have normalized.
And I hope my company, News Corp, mandates vaccines for employees who want to physically return to the office. The federal government is paying compensation to hundreds of Australians who have vaccine injuries from the COVID jab. 3,501 people have applied for vaccine compensation, and this out of the 66 million vaccine doses given. Some of the COVID injuries include life-altering heart inflammations, damaged capillaries, and autoimmune disorders. There are also thousands who've applied for compensation and are waiting to hear back. They are Orwellian-style laws that give a government entity the power to control free speech. This censorship has already happened with COVID mandates and vaccines. No government, Liberal or Labor, can be trusted to be the arbiter of what's the truth, what's factual, and what's misinformation. We've had Wuhan, the Hunter Biden laptop, COVID vaccines.
Breaking any laws by doing that?
You are actually. You are breaking all. That's why I'm arresting you.
I'm so sorry to hear you've been through all of this, but good on you for your incredible courage, for standing up to authority. You want to know that the people sitting alongside you, breathing in the same air as you, have also been vaccinated.
Yeah. So, what's so unbelievable about this is, one, this is exactly who the people in the corporate press are. They will turn on a dime without question, without fail. They are completely in allegiance to the narrative. But what we also need to understand is there are people who are good individuals who were co-opted by the narrative because they were propagandized into it through the process of fear. And fear is a very powerful tool, and I'm not sure if this lady believes everything she's saying or she's just espousing the narrative so she can try and get along because she realized the nature of how much she had overstepped with what she was pushing, or if she realized what she was pushing was so genuinely wrong and that she was incredibly out of bounds for doing so, and in the process she seeks to make wrong, or she seeks to make right for what she had done wrong. And if that is the case, this is exactly what we need. People like this to stand up and own the fact that they were wrong and say, we operated as the totalitarians in society and we need to be held accountable for it. Let's go ahead and jump into this article. Let's go. This is the article that spawned this entire segment when I saw that tweet from MSNBC where they talked about the fact that COVID seems to be affecting people in the same way that allergies, the cold, and the common flu appear to be doing so. Same way in the fact that it appears that doctors are having trouble discerning between them. Isn't that just unbelievable? Let's go ahead and jump into the title of this article because there's always something to glean from the title of an article written by the corporate press. There's always one little bit of factual information in there, and then they ostracize a bunch of the relevant facts, and then they paint their narrative and hand you a platter of shit telling you this is the information that you need to consume. So, sore throat, then congestion, common COVID symptoms follow a pattern now, doctors say. Doctors who treat COVID describe the way the illness has gotten milder and shifted over time, mostly affecting their upper respiratory tract. This was always an upper respiratory virus. Let's start there. So what we see is doctors who treat COVID describe the way the illness has gotten milder and shifted over time. Okay, so the reason the virus has gotten milder and shifted over time is because it's gotten more contagious and less lethal, much like basically every single virus throughout all of human history that we've had to deal with. The reason this happens is because the virus is trying to spread and it's trying to become more amicable with our body so we don't end up having our core temperature get raised, burning it out and ostracizing it, effectively killing it. What the virus wants to do is survive and infect as many hosts as possible. But that can't happen if we are consistently raising our core temperature and killing it. Okay, let's go ahead and move on to the top of this. Common COVID symptoms follow a pattern now. Really, just now, because they actually followed a pattern before. It started with the fact that you would lose your sense of smell, you would then lose your sense of taste. What would happen is you would get a deep cough, you would sometimes get congestion, it would turn to a dry cough if there was no congestion, and a lot of times you would get muscle fatigue, you would become weary, you would become incredibly low energy, and with that, what we saw is it's basically affecting you the same way that a cold blowing you over or the common flu wiping you out is. Isn't that just unbelievable? Let's go ahead and get into it. Doctors say they're finding it increasingly difficult to distinguish COVID from allergies or the common cold, even as hospitalizations tick up. Does that not make you want to facepalm so hard that you crater your forehead into the back of your fucking scalp? The illness past hallmarks such as dry cough or the loss of sense of taste or smell have become less common. Instead, doctors are observing milder diseases, mostly concentrated in the upper respiratory tract. As I stated, it's basically always been an upper respiratory virus. You can even go look at the footage of Anthony Fauci talking about this in the beginning of March of 2021. So, it isn't the same typical symptoms that we were seeing before. It's a lot of congestion, sometimes sneezing, usually a mild sore throat, said Dr. Eric Eiding, Vice Chair of Operations for Emergency Medicine at Mount Sinai in downtown in New York City. The sore throat usually arrives first, he said, then congestion. So, the ZooCovid symptom study, which collects data on self-reported symptoms in the UK through smartphone apps, has documented the same trend. Its findings suggest that a sore throat became more or less common after the Omicron variant grew dominant in late 2021. Loss of smell, by contrast, became less widespread, and the rate of hospital admissions declined compared to the fall of 2021. Okay, pause. We don't actually have proper numbers when it comes to the people that went into the hospitals or died from COVID because of how the hospitals were being incentivized to track their records when it came to the fact of people being ill with COVID. We don't have proper numbers on people going into the hospital with COVID or people getting sick in the hospital from COVID. We don't have the proper numbers on the death toll because people weren't incentivized to do this in the right way. They were genuinely enforced by Big Pharma to go ahead and be paid more based on the fact of if they declared that they had COVID deaths or not. And this is why you saw so many people that were actually being declared dead from COVID throughout the pandemic that genuinely were. And this is why you can go ahead and look this up. There are lawsuits from families that are suing hospitals and suing multiple medical institutions because of this. Go ahead, go pull it up in a separate tab and go read it. What we see is doctors now describe a clear and more consistent pattern of symptoms. Just about everyone who I've seen has had really mild symptoms, Eiding said, out of his urgent care patients, adding, the only way that we knew that COVID was around was because it happened to be testing them. It's that insane. They're testing people for their yearly allergies. They're going ahead and checking people naturally because they have the cold and it's flu season, and they can't even tell and see if these people actually have COVID specifically, all because COVID is almost indiscernible from the common cold and the flu now. Isn't that unbelievable? How do COVID symptoms progress? Through 3 doctors interviewed said COVID commonly becomes a sore throat these days, and they gave differing descriptions on the severity. Dr. Grace McCombsey, Vice Dean for Clinical Translation Research at Case Western University, said some patients have described a burning sensation like they've never had, even with strep in the past. Then as soon as the congestion happens, it seems like the throat gets better, she said. Along with congestion, doctors said some patients experience a headache, fatigue, muscle aches, fever, chills, or postnasal drip that may lead to a cough, though coughing isn't a primary symptom. Sounds like, I don't know, allergies, the flu, and the cold. McCombsey said fatigue and muscle aches are usually the last of a couple days, whereas congestion can sometimes last a few weeks. Yeah, sounds roughly normal. She estimated that only 10 to 20% of her COVID patients lose their sense of taste or smell now, compared to roughly 60 to 70% early in the pandemic. Okay, pause. We're going to give a little fun fact. So, during the time that she's talking about, where 60 to 70% of the people during the pandemic were losing their smell, you can go look this up. You can go look at Yankee Candle's profits. Look at their margins from 2020 to 2022. And you can actually go ahead and look at the graph, and there are people that show this. Look at their profits and their return margins and their return rate. As the return rate skyrockets, their profit margins dwindle. And what happened was, because people didn't have their sense of smell, they were returning their Yankee Candles en masse. And that's absolutely hilarious to me. They would probably go to the store, they weren't really ill with COVID, or maybe they even got it at the mall when they went to go get their candle. And they'd smell their candle, they'd think it smelled great, they'd bring it home, and then a couple days later they'd go to burn it, and they'd go to smell it, and they couldn't smell anything. So they'd return it. And this probably happened so much for Yankee Candle to the degree where they lost an insane amount of money. Okay, moving on. Eiding said he's not seen anything like diarrhea lately, either a more common symptom in the past. So, bless everyone that really got sick with COVID, that this was not another facet of how you had to be ill, because, my God, that shit would have sucked. For the most part, the doctor said a few patients require hospitalization, even those who show up at emergency rooms. Many recover without needing antiviral pill Paxlovid or any other treatment. Isn't that just interesting? seems like people are able to recover without any excess treatment. We know one thing that was excess treatment that was given to people during the height of COVID freakout was something like respirators. And what happened was, it turns out respirators were actually blowing out people's lungs en masse, and it was killing people. There are so many people that died in New York, both in nursing homes and in hospitals, because they were put on respirators, and that was something that did not help them. And it just led to so many people, unfortunately, passing. Let's go ahead and move on. Why COVID seems milder now. And here's the deal. We know why COVID seems milder now. I already explained it. It's how the process of how a virus evolves. So, we're going to go ahead and see that Dan Borshak, director of the Center for Virology and Vaccine Research at Bethel Israel Deacon's Medical Center in Boston, attributed the medical symptoms and the mild symptoms that doctors are all seeing to immunity from vaccines and previous infections. Notice what they did there, from previous infections. What that means is they're talking about natural immunity. Okay, now let's actually see that MSNBC talk about the fact that natural immunity is more efficacious than the immunity provided from the vaccine. Except they won't. There are people who got SARS-CoV-1 18 years ago that were tested at the beginning of the pandemic that still had the antivirals in their blood to protect them from SARS-CoV-2. Is that not absolutely insane? It's almost like natural immunity is superior. So, who is being hospitalized? The U.S. is recording around 19,000 COVID hospitalizations per week, according to the Center for Disease Control and Prevention. The weekly average rose around 80% from early August to the beginning of September. And again, we don't know if this is the fact that they are reporting people with COVID that are going to the hospital because they're sick with it, or it's people that are already in the hospital and then they're getting sick because there are people in the hospital with COVID and they're getting ill and then they're getting tested, and because of that, then they're being reported the fact that they're in the hospital for COVID. So, hospitalization rates are highest among people ages 75 and up, understandably so, followed by babies under 6 months, which is statistically non-relevant when it comes to the fact of being completely affected by any long-term negative effects from COVID, and adults ages 65 to 74. So, they mentioned young children just so they could go ahead and scare people, because if you want to go ahead and look at the data, children are statistically non-relevant when it comes to the fact of how COVID will be affecting them. This is one reason that I would argue giving your children a forced medical mandate that is nothing more than, I would argue, experimental gene therapy is not something that is safe. You should go ahead and let, I don't know, their immune system take care of them, much like mankind's immune system has done for thousands and thousands of years. Anyways, either way though, I'm not a medical professional. You make your decisions by talking to your doctor and your child's doctor. Always be the person who is the final arbiter of those decisions if you are the parent. Never let the doctor be the person who is just consistently trying to sway you into something that you feel uncomfortable with. Always make sure that you're well informed, read up on these things, because as we saw during the COVID crisis, many doctors are nothing more than yes men, and that is something that is truly terrifying. If you thought this was bad, just wait till the ChatGPT generation gets a hold of their medical degrees and the person doing your surgery has to look up online the process of what they need to do. Moving on. What we see is older people in particular may have been waning with immunity that they had with their... Oh, no way! Older people having waning immunity because they had the vaccine, and the immunity from the vaccine had fallen apart. Oh no! It's almost like this is something we knew about, and this is actually a major thing that was talked about that Dr. Fauci spoke about before his narrative ended up shifting. When he talked about the fact that what happened is you can't vaccinate during a pandemic, because what will happen is you'll end up making people's immune systems go haywire and they'll start fighting off the virus. And what the virus will do is self-replicate and create a bunch of different variants, and it'll start spreading like wildfire because it's trying to survive and it's trying to fight off the vaccine. In the process of trying to fight off the vaccine, it has to create different forms of itself so it can go ahead and survive and proliferate and go ahead and infect more people. Man, that was a mouthful. So, how long does COVID look like now? A study published this month found that long COVID rates declined once Omicron became the dominant variant. And genuinely, I'm just going to go ahead and say this. I think long COVID's a load of horseshit. Maybe I'm wrong about that, but I genuinely think it's people that are suffering from this mental weight that COVID has plagued them because they've been propagandized through fear, and it's just made them have these things where they're absolutely torrentially terrified of absolutely everything. And I think a perfect example of this is the fact that we are in the year of our Lord, 2023. It is September 18th, and there are still people wearing masks because they think they help them. And don't get me wrong, if it makes you comfortable and it makes you feel like you're safe, that's fine. But you need to understand that it doesn't work, and trying to force me to do something that doesn't work only makes you look like a fucking idiot. So, I'm going to go ahead and leave it there. Thank you for watching if you got this far. Really appreciate everything that people have been giving me so far recently. This channel's been getting a lot more traction than I really would have expected. We hit 100 subscribers far faster than I would have anticipated. Thank you for watching. Share this with someone if you enjoyed it. Give it a thumbs up if you liked it, a thumbs down if you didn't. Tell me where I'm wrong in the comment section down below. Stay lovely, stay great. Peace out.